So today we are going through shoulder. Shoulder girdle. What are the two parts of the shoulder that make up the shoulder girdle? Scapula is one, clavicle is the other. Humerus, y'all, is not a part of the shoulder girdle. However, the humeral head does make up part of the shoulder joint. Is that about as clear as mine?
Yeah.
So two things you need though. Shoulder girdle is made up of clavicle, scapula only. Humeral head joins in with the glenoid fossa or glenoid cavity to form the shoulder joint. So some things I need you to know. Clavicle's a long bone, okay? Has two extremities, two ends. The end closest to the breastbone or the sternum is where you find the SC joints. What are those? SC. Sternoclavicular. Very close. Very, very close. Sternoclavicular joint. So this joint here where the clavicle and the sternum meet, sternoclavicular joint. All right? And that's the medial end of the clavicle. Clavicle comes and it curves, comes up to the lateral end of the bone, and that is, we call that the acromial extremity, the acromial end of the clavicle, because it's closest to what we call the acromion, which is another part actually of the scapula. So we'll talk about that in a second. So here's the clavicle, or we call it the collarbone, layman's terms. This little area that protrudes out right here, everybody see that? It's right below the clavicle, right here. It is the coracoid, and that is one of our positioning landmarks that we will palpate, that you'll be able to feel. It is below the acromial end of the clavicle. All right? Now let's turn around and let's look at your shoulder blade. What's the shoulder blade? Scapula. And it's actually triangular shape. It's got three borders. The medial border is closer to your spine, okay? Then you got the lateral border here, closer to the lateral aspect. Then you've got the superior border here.
And then the inferior.
Huh?
Inferior.
So, well, hold on, I'm gonna get there. So we got the three borders, the medial, the lateral, and the superior. Then we have three angles. This is the inferior angle, this point down here. This is gonna be your superior angle, this point up here. And then you've got your lateral angle here. Your scapula is divided into two sections. Do you see this long bone? Almost looks like a clavicle, doesn't it? But it separates the scapula into two sections, and we call that the spine of the scapula. The area above that is the supraspinatus fossa. The area down here is the infraspinatus fossa. Supra means above, infra means below. And if you've ever heard of the supraspinatus muscle or the infraspinatus muscle in biology, supraspinatus muscle attaches in here, the infraspinatus muscle attaches here. They're separated by the spine of the scapula. Well, as the spine, and it's palpable, you can feel it, as it extends, it ends at an area called the acromion, which is kind of convenient because that's also the acromial end of the clavicle in front of it, right? So this is the acromion. It's going to be important when we're positioning for the shoulder. I also want you to pay attention to the fact that the scapula is a flat bone, but it is not flat in our chest like this. Can you tell that it's angled? If I'm standing straight like this, see how the scapula body actually is angled this way? It goes with the angle of our ribs because it's kind of a protectant for our ribs. It's like a shield there for our ribs. So you need to know that it's angled in there because that's going to be important in one of our positioning, for positioning of one of our projections. So questions about the scapula clavicle anatomy. And then you got the joint space. This is the scapulohumeral joint space, or the glenoid cavity or glenoid fossa. That's this area here that comes off of the scapula and where the humeral head joins that area. That's a ball and socket joint. Okay? So that's anatomy there. Now, let's talk about our projections.